With technological innovation, healthcare delivery has increasingly shifted away from expensive stays in acute care hospitals. A variety of outpatient settings and services have become common. Although hospital stays have declined, hospitals in the form of integrated delivery systems still play a major role in outpatient care. The many advantages of group practices or for doctors working for an integrated delivery system has led to the decline of solo office practices. The government continues to fill the void in areas where outpatient services are still lacking. These are areas considered to be medically underserved and are both in urban and rural setting. Other facilities like school health, Native American nations, and other settings can also be at times considered as a medically underserved area. Although the terms outpatient and ambulatory care are used interchangeably, and you will see this a lot in the literature, as well as social scientists when they do their lectures, the truth is outpatient is more comprehensive. So we normally tend to use that terminology more often, outpatient care. Now, ambulatory care consists of diagnostic and therapeutic services and treatment for the walking, or what we call ambulatory patient, hence the term ambulatory care. Now, why is outpatient services considered to be more comprehensive? It's because outpatient service refers to any healthcare services that do not require an overnight stay in a healthcare institution, and it also covers those services given to patients that cannot ambulate or bring themselves physically to a healthcare facility that is an ambulatory setting. So ambulatory care, again, are meant for patients who can bring themselves physically to doctors' offices or clinics, like urgent care, even outpatient surgeries. So again, for patients who have problems physically bringing themselves to these facilities, they could benefit very well from mobile clinics and home health where the services are brought to them. That is then part of outpatient care. That is why we said that outpatient care is more comprehensive, because it's not only for the walking or ambulating patient, it could also include patients that could not physically bring themselves to these healthcare facilities to seek treatment. Because hospital inpatient stays continue to decline, hospital and health systems, also known as integrated delivery systems administrators and executives, have now considered outpatient care as a strategic part of their business plans to bring in revenue. Several key changes have been instrumental in shifting the balance between inpatient and outpatient services. Reimbursement is one. Both private and public payers, meaning government programs like Medicaid, Medicare, S-CHIP, and then private payers such as private health insurance plans through the health insurance companies that run them. Both private and the government have a clear preference for outpatient treatment because it costs less than inpatient care. Now, technological factors is another reason for growth of outpatient care. The development of new diagnostic and treatment procedures and less invasive surgical methods has made it possible to provide services in outpatient settings that previously had required inpatient stays in hospitals. One perfect example would be surgeries that can now be done in outpatient settings. Another reason for growth of outpatient services is utilization controls. This utilization is actually done both, again, by the government programs, payers, and like Medicaid, Medicare, as well as private insurance companies' health plans. So both of them, for the most part, require prior authorization for inpatient admission and close monitoring during the hospitalization itself. And of course, the main objective is to minimize the length of stay of the patient in that inpatient care setting. Social factors is another reason for outpatient growth, outpatient services growth. Patients normally have a strong preference for receiving healthcare in home and community-based settings. This actually improves their quality of life. You know, you would rather be convalescing or recovering in a much more familiar location, such as your own home, rather than being institutionalized. That's the end of lesson 1.